Medicare 2015 Simplified. What does Part A and Part B cover? Thanks to information from United American Insurance Company. Part A is hospital insurance. It covers costs associated with confinement in a hospital or a skilled nursing facility. Part B is medical insurance. It covers physician services, outpatient care, including tests and supplies. So what does Medicare cover and what do you pay? Let's look at a timeline. If you are hospitalized for 1 to 60 days, Medicare covers most confinement costs after the required Medicare deductible. You pay the deductible, $1,260. If you are hospitalized for 61 to 90 days, Medicare covers all eligible expenses after the patient pays a per-day copayment. You pay $315 per day copayment up to as much as $9,450. If you are hospitalized for 91 to 150 days, Medicare covers all eligible expenses after patient pays a per-day copayment. These are lifetime reserve days that may never be used again. You pay $630 a day copayment up to as much as $37,800. If you are hospitalized for 151 days or more, Medicare covers nothing. You pay all costs. For skilled nursing confinement, following an inpatient hospital stay of at least 3 days, and enter a Medicare-approved skilled nursing facility within 30 days after hospital discharge and receive skilled nursing care. Medicare covers all eligible expenses for the first 20 days, then all eligible expenses for days 21 to 100 after patient pays a per-day copayment. After 20 days, your copayment is $157.50 a day, as much as $12,600. Now for Part B. On expenses incurred for the annual deductible, Medicare covers incurred expenses after the required Medicare deductible. You pay $147 annual deductible. On expenses incurred for medical expenses, which are physician services for inpatient and outpatient medical, surgical services, physical or speech therapy, and diagnostic tests, Medicare covers 80% of approved amount. You pay 20% of the approved amount. On all Medicare-covered expenses, a doctor or other healthcare provider may agree to accept Medicare assignment. The patient will not be required to pay any expense in excess of Medicare's approved charge. The patient pays only 20% of the approved charge not paid by Medicare. Physicians who do not accept assignment of a Medicare claim are limited to the amount they can charge for covered services. In 2015, the most a physician can charge for services covered by Medicare is 115% of the approved amount for non-participating physicians. Note, in New York, the most a physician can charge for services covered by Medicare is 105% of the approved amount for non-participating physicians. For routine office visits covered by Medicare, a non-participating physician can charge up to 115% of the fee schedule amount. On expenses incurred for clinical laboratory services, such as blood tests and urinalysis, Medicare covers generally 100% of the approved amount. You pay nothing for services. For home health care, part-time or intermittent skilled care, home health aid services, durable medical supplies, and other services, Medicare covers 100% of approved amount and 80% of approved amount for durable medical equipment. And you pay nothing for services and 20% of approved amount for durable medical equipment. On expenses incurred for outpatient hospital treatment, which includes hospital services for the diagnosis or treatment of an illness or injury, Medicare covers payment to hospital based on outpatient procedure payment rates. You pay coinsurance based on outpatient payment rates. On expenses incurred for blood, Medicare covers 80% of the amount after the first 3 pints of blood. You pay for the first 3 pints plus 20% of the approved amount for additional pints. Excess doctor charges, which are above Medicare approved amount. Medicare covers 0% above the approved amount, and you pay all costs. If you choose Original Medicare, which is both Parts A and B, you qualify for a Medigap policy. This is a Medicare supplement that helps fill in the gaps. Find out more. Learn the cost of each plan and what it could do for you. Get your questions answered about Medicare. There is much to consider. Don't leave it to guesswork. Learn about your options to make the best decision for you and your loved ones. Call Nanette Damasio, Independent Insurance Agent and Regional Vice President, Nevada, at Schnock Financial Group, 888-734-6575, extension 527. Or email plan4@taxfreelife.us. Learn about the 4 parts of Medicare and the penalties for not enrolling on time. Look for my YouTube video, Medicare Simplified, Parts and Penalties.